Hi, my name is Dr. Jack Choate. I'm a chiropractor at the Spinal and Sports Care Clinic, and I would like to talk to you today about whiplash injuries. I've been doing this now for over 25 years, and whiplash injuries are not to be taken lightly. So if you're seeing this video today, there's some very important things that you should know. Whiplash injuries occur when a vehicle is hit from behind by another vehicle. Now, what I want you to know about this is that injuries can occur to the soft tissues in speeds of as little as 10 miles an hour and less. Now, the reason for this is that the vehicles today have very sophisticated, high-tech bumper systems that are designed to absorb that energy to minimize the vehicle damage. Unfortunately, that energy gets transferred somewhere else, and that goes to the occupants of the vehicle. So even if your car is relatively unscathed, if you have any kind of symptom related to headaches, neck pain, back pain, arm symptoms of that nature, and you didn't have it before, there's a good chance it came from this type of rear-end collision. So what happens in a whiplash injury? Here's a model of the spine, and basically what I want you to see is this. The neck has a normal curve. It arches forward in this direction with the back of your head resting right here. Through a series of detailed mechanisms, when your vehicle gets hit from behind, that curve becomes changed. It turns into more of like a C curve or a loss of the normal curve, and that's not good. So when you lose that normal curve, a lot of things happen. Not only can your muscles be strained, but you can sustain damage to your cervical facet joints. The facet joints are tiny little joints that connect between the spine, and studies have shown that facet joints are significantly injured in especially whiplash type of motor vehicle accidents. Chiropractors are experts in diagnosing and treating injuries of the cervical facet joints. So if you have any kind of symptom related to a whiplash injury, you should be seeing a chiropractor because we're extremely qualified. We are the experts in treating these kinds of injuries. So what kind of symptoms? As I mentioned before, any kind of neck pain, arm pain, numbness and tingling, headaches, sometimes even things like vertigo or equilibrium problems can be related to whiplash injuries. So what do we do about treatment then for these types of injuries once you have it? Chiropractic has been around since 1895, and the hallmark treatment that we've been doing is a therapy called spinal manipulation, where we introduce a very specific pressure and realignment to those cervical facet joints so that you unpinch your nerves, you have better range of motion, less stiffness, and less pain. There are times when we may not want to use spinal manipulation, so we use an instrument such as this. It's called an activator. It's a very low force, highly specific way to realign facet joints by using a fast spring mechanism that realigns the facet joint, and you hardly even tell that it's been done. Now, we also address soft tissue injuries, the muscle component and fascial component of these whiplash injuries, because we acknowledge that there is a strain, sprain, injury. Strain applies to muscle tissue. So one of the things we might use is this instrument here. It's called part of a technique called Graston myofascial release technique. If I were to use it on my arm, I would put a lotion on the arm and then use the instrument in a gentle gliding pattern in different directions. And what it does is that it breaks up things like scar tissue, fibrosis, adhesions, anything that would restrict or limit normal muscle movement that would generate pain or stiffness. An extremely effective technique. We also use high-tech devices such as a low-level or a cold laser. It's a device that speeds up the healing time by reducing inflammation, and it's a painless device by emitting a special type of laser or LED light that applied directly to the skin. Extremely effective. And then finally, once you're starting to feel better, we may need to do some rehabilitative exercise, stretching muscles that are too tight and strengthening muscles that are weak. So we want to make sure that we employ a certain amount of exercise therapy to get you feeling your absolute best. In situations where you need an extensive amount of soft tissue therapy, we have a team of highly qualified an experienced massage therapist here at Spinal and Sports Care that can also help you feel your absolute best. So overall, if you've been in any kind of a car accident, especially a whiplash, don't take it lightly. You only get one chance to treat this particular injury. Don't take it lightly. Come and give us a call so we can evaluate you and treat you properly. Our number here is 922-0303. Thank you.